Well, I just wanted to say one, thank you so much for participating in this, Zoom recording presentation, ADA 30 accessibility post. I truly, truly appreciate you, and I've missed you.
Well, I'm glad to do it, and I hope you're doing okay.
We're okay, it's working through the new normal and trying to figure out next steps and best practices. How are things where you are?
Well, it's I live in the San Francisco area, so it's I think we're all dealing with a new reality. It is not going anywhere anytime soon. A lot of our grantees are healthcare providers, and at this point, I'm just firm, and everything I get from them is whenever we have a vaccine that's widely available, tack on 3 months, and that's when people with disabilities, people who are vulnerable, can start the process of returning to some semblance of normal. But so it's a ways away, but in some ways, I hope that with COVID-19 that it has kind of shown the experiences that the disability community has always struggled with and like drawn attention to it. So I hope that it out of this is an opportunity and more support for the issues that the disability community has always struggled with will happen. But we'll see.
We'll see. We're both cautiously optimistic, right?
Yeah, exactly.
Well, once again, I want to thank you and welcoming Brian Easterly to our bigger conversation on ADA 30 on this illustrious day, which I think is the official celebration of ADA 30 here on July 24th, even though we know it's technically July 26th because it fell on a Sunday this year. I think you're here with us on the official formal day that it's being recognized, at least in a lot of government situations and in the media as such. So we want to thank you so much for that. I also want to make sure that we shout out that Mr. Easterly is a proud son of Alabama with the sweet tea palate to prove it. He loves to tell us about the sweet tea in Alabama. And he is an experienced grant maker, strategist, and advocate who is driven by a desire to have meaningful change. And we're here to kind of have a conversation and ask him a couple questions and get his response and his feedback in the community. And I wanted to speak to you about people's access to resources and power. I know that you speak a lot about that in the work that you do and in your outreach. What intersectional issues do you see and have addressed in having that conversation with regards to the disability community?
Excellent question. I think it's always important to point out that with the disability community, especially Black folks and individuals of color with disabilities, there is still a struggle for some basics, the basic access to resources and access to power. Whether we look at areas such as employment or technology access, those are still a struggle. But in the conversations that I focus on as working in the philanthropic sector, I focus on supporting the conversations that funders have to basically encourage and support funders in embracing a community participatory approach to their grant making. So when I say that, it means using processes that have the individuals most impacted by an experience, by an issue, involved in decision-making positions within that grant making, within that funding. So making sure that the communities that funders are seeking to benefit are part of the decision-making process, are the decision makers themselves. Because it's only with that approach that programs can truly evolve, programs can truly be supported in meeting the needs of the community. So often, especially when we look at the history of philanthropy, the communities that traditional philanthropy has sought to serve and sought to benefit haven't been found in those structures. So really having those conversations to say, here's how you can embrace a community participatory approach, and here's how we can support you in that. With is one of the few endowed foundations in the country that when we look at our structure, we have individuals with lived experience of disability at both the board level, the staff leadership level, and we have an advisory committee. And I think it's important to also point out that sometimes we're all aware of tokenism can happen, but making sure that when you're embracing a community participatory approach, that it reflects the full diversity of the community, that there are multiple perspectives. I have had the experience of being an individual with multiple disabilities all my life, pretty much. But that doesn't mean that, I am the arbiter of all things disability. So even within WIS's work, I find it important to have board representation, other staff representation, and the advisory committee that helps push me and evolve where, my own experience of disability. So that's what the work that I do focuses on, but it's really saying to funders, embrace a community participatory approach, because it's only when you do that, it's only when you have community members that have that seat at the table that you can truly support programming that's going to actually get the access to individuals that need it the most, and give power to individuals that can use it wisely and develop things that address the issues most effectively.
Absolutely. I know me and you have talked a lot about having seats at the table, getting in, if I can do a little Hamilton hashtag, in the room where it happens.
Exactly.
Not just as a person there at the seat at the table taking the notes, being asked for input, being part of that decision. And that kind of transfers us over to this other question I had for you. I know that you work very hard with regards to defining and refining and evolving the idea or the perspective of comprehensive healthcare. How do you feel the ADA, that legislation, addressed that? Did it? Are there gaps with regards to that? Because I know that we look a lot and people pull on the ADA, but where do we find some of these gaps with regards to comprehensive healthcare?
The ADA has assisted in improving some physical access and some communication access to medical services. But to be frank, as people with disabilities, as a healthcare funder, I'm very aware further advancement needs to be made. It's still a struggle for folks. Ideally, we want to exist in a world where all people with disabilities can access medical care and medical services in ways that are culturally competent. And when I say that, I mean that address their individual backgrounds and their individual experiences, and also value their perspectives as individuals with lived experience when they're receiving those services. That isn't happening. That is a limitation of the ADA. There are ways that the ADA supports that happening, but still it's not the average experience, unfortunately, for Joe Smo, person with a disability, to say, I receive culturally competent care. It is not the experience that we know that people with disabilities still face hardships if they, in some cases, if they're trying to access their local community health clinic or their local community provider. We know that individuals who need gynecological services sometimes experience issues in accessing those services. So although the ADA has made way for improvements, it is still a struggle, and there still needs to be continued advancement of some of the basic principles of the ADA, there also needs to be more efforts to address the attitudinal barriers that exist for people and the further education that needs to continue to happen to ensure that culturally competent care is delivered to people with disabilities when they're receiving medical care. Also, as someone who's located in the Bay Area, I think a lot about digital health, and we're very aware of, technology is changing how people receive healthcare, and making sure that in the digital health space, that the tenets of universal and inclusive design are embraced when you're developing digital health structures. So that saying that means that individuals with disabilities are part of the initial design process rather than an add-on after it's been developed after the fact. So making sure that you are mindful of the experiences of the accessibility needs of individuals in the initial design. With COVID-19, as I alluded to earlier, we know that this is really, it's brought further emphasis to the experiences of people with disabilities, especially black and brown folks with disabilities, in the issues and the struggles we've faced. I'm very mindful of, the needs around telehealth. So we know within healthcare, especially with COVID-19, there's lots of conversation, lots of additional support now going into telehealth. But there are still basics like access to technology that we need to be mindful of. So I think the ADA made way for some initial improvements, but there's still so much further we have to go. I'm also a little bit fond of trying to point out that, the ADA is the bare minimum. That's how the ADA is defined, is here is the bare minimum of how you should address the needs of the disability community, of those that experience disability. That it is the bare minimum, it is the start, but there's so much beyond that. So that's what I'm mindful of. I'm very thankful for the ADA, but it is just the beginning. It is just the start.
I love that. Thank you so much, because we try and say that as well. We will say, you are ADA accessible. Now, do you consider yourself to be inclusive? I always want to ask that next question, because I know a lot of their concern is, well, are we in compliance? Do we meet, as you said, the minimum standard? But we don't want to meet the minimum standard. You want to go beyond that to make sure that you are providing that comprehensive and culturally competent access to your business, to your healthcare center, to the community in general. So we do have to continue to push for those questions to be asked and answered. Speaking to that, I know that you want to discuss a little bit about your experience as you identify as having a multiple marginalized identities. Where do you see this movement of equality within the disability community and beyond moving forward?
As someone who identifies as Black, gay, an individual with disabilities, so that means both apparent and non-apparent disabilities, and as someone who was a former foster kid, I really would like to see the disability community continue to work to advance the full diversity of the disability community. So making sure that Black and brown individuals are in places of decision making, up in places of leadership, and are well represented within our work and within the leadership of organizations that serve and represent the disability community. I also would like to see continued advancement to embrace an approach of equity and liberation for all individuals with disabilities. And looking at things such as embracing a disability justice framework to our work. So disability justice centers the needs and perspectives of multi-marginalized individuals, so meaning Black and brown individuals, plus individuals in the work. Because when we look at the disability community overall, we know the CDC says 1 in 4 Black individuals experiences disability. Although we may not see it in our current representation of what disability is, the average person that experiences disability is a Black or brown individual. So I would like to see the community continue to work to advance these perspectives and see that they're in the rooms where decisions happen, in the rooms where programs are developed, because that is what's going to take us to the future, of the disability movement, so to speak. Also, when I think about the disability movement overall, I would like to continue to see us be mindful that many members of the disability community may never identify as advocates. They may never understand much more beyond the ADA. They may not understand the differences between people first language versus identity first language.
Right.
But their perspectives, their experiences are still valuable. They should still have seats at the table. Our work still benefits them and should benefit them. So kind of being mindful and intentional about remembering that, many people that are part of the disability community may not be part of the professional advocate kind of grouping. So, but that's where what I think about the future of the movement, or what I hope for the future of the movement, that we truly embrace equity, liberation, we embrace disability justice, and we really are mindful that we represent people that may not understand, kind of all the disability theory, but they are still valuable members of the disability community.
I think me and you can both agree that it's good to have various perspectives at the table. And it's just kind of like a little bit insider baseball with regards to understanding, person with a disability versus people first language, or identifying yourself as a person with a disability or a person with a chronic condition. It's all varying levels of language and description, and trying to make sure that all of those terminologies are acceptable voices at the table, because difference is good. If we have all the same caveats at the table, then we don't really make that meaningful change that you talk about in your work and being who you are. I wanted to kind of get into a little bit about that. How do you see, or how do you define, because I loved when you said that in part of your bio and presentation, that you're always striving for meaningful change. What does that look like? I love the fact that we've got the right people at the table, we're accepting more voices, but do you see a pathway to helping to make that work? Is it more education in schools? Is it better outreach in the community? What can we do to help push for more of that meaningful change that you've inspired in us?
I think meaningful change is, regardless of the issue, obviously, we're talking today about the disability experience, but I think it's really in any community. If you look at the most impacted within that community, if they start saying, this works for me, or this reflects my experience, that's when you know it's meaningful change. When you start to see, a change within the most impacted within a community, that's to me when meaningful change has occurred. I think, like you mentioned, as far as how we make that happen, it is further education. And to me, in my work with the With Foundation, and within my over decade career within philanthropy, I've tried to support and foster more education amongst funders, because it does change can happen if those that are funding programming are part of it or support it. Nothing helps programs and organizations, like in some cases when I as a funder can say, can you tell me where in your budget there's accommodations, or can you tell me within your programming how you're embracing a disability justice framework? Can you tell me, on your boards, how are you including the perspectives and experiences of Black and brown folks with disabilities? As a funder, that's what we can do, and I feel like that's what I devote efforts to doing. But I also think, in general, it's more work needs to be done to bring voices from all generations, from multi-marginalized individuals, and it's that's on all of us. When I look at my own life, I try to support folks and get folks to the table in all different ways. For me, it's both big and small ways. It's I have a 1/3 principle. So only 1/3 of the time that I'm asked to speak somewhere will I say yes. Most of the time, my answer is going to be no. But what I love to do is say, but here are other folks that can speak. Here are other folks that can advise. So finding ways, both big and small, to create avenues for other folks to say their perspective. That doesn't mean that my perspective is not valuable. I am multi-marginalized and I have a very unique life story. I didn't grow up with money, all that, but it just, to me, it also means that I have an opportunity to speak. And, if only 1/3 of the time I, take advantage of that opportunity, I'm still fine. But to other folks that, get that seat at the table or get that opportunity to advise, it matters. So, but to me, I think how we support that is, again, doing education, finding ways to support each other in the work, and also remembering to give ourselves space in doing this work and self-care, because advocates of all sorts, comrades in this work, burnout is a thing. And especially in these times, we don't want to lose any advocates. So in doing the work and being a part of this, I hope to support folks in continuing that when they need to give themselves the space to care for themselves, because that's an important aspect of the work. It's, you won't see as many pamphlets about it, as many programs designed around it, but it is equally important, especially for multi-marginalized individuals.
Yes. Because you're dealing with it on various fronts and many different levels. And I think that is really very critical. And thank you for bringing that up. That's one of the things that we really haven't had an opportunity to discuss. And I love what you said about the little things and the big things. Kind of have to do both to make meaningful change. And that you see that change when that person says, this meant something to me, or that moved us forward. And then, as another one of our colleagues said, you share the candy. You don't have to be in the spotlight all the time. You say, I have this wonderful individual over here, and he or she may be able to speak better to this than I could. Give them an opportunity. I think that whole framework is how we're going to see ADA 60 be better than what we see here in ADA 30. But yes, Mr. Easterly, I'm going to give you the floor for the next 3 or so minutes to go ahead and close this out. Was there anything else you wanted to leave us with? I have so many hashtags in my mind right now of what you said and how we're going to push this message forward. What would you like to close out with?
I would just say, when we're looking at the future of the ADA or ADA 60, or the future of the disability movements, we must include the perspectives and experiences of Black and brown folks with disabilities, both apparent and non-apparent disabilities. If we're not doing that, if we're not being intentional in addressing the needs of individuals with these experiences, it will be to the detriment of the movement. It's important that when we envision the future and when we work towards the future, I envision and I hope for a future in which we can imagine individuals with disabilities, Black and brown folks with disabilities, working in jobs, leading efforts that are not disability focused. Multi-marginalized folks have a lot of experiences. Just because you have a disability, it doesn't mean that disability has to be your primary identity. So as we envision a future, can we envision it in a way in which we have members of the disability community, we have efforts and programming that don't automatically dictate the need for disability to be your primary identity. And just to be mindful of the words of Andre Lorde, that none of us lead single issue lives. So as we look at the future, find ways to support that, because none of us, I know you very well, none of us, we're not just one thing. So
Right.
in envisioning the future and working towards that, truly finding ways to support and embrace that.
Well, I can't close out any better than that, other than to say, Mr. Easterly, Ryan, thank you so much for joining us. We truly appreciate you, and I want you to continue to stay safe, to be strong, and we hope to see you on the East Coast soon. Everybody watching us, thank you so much for participating. Mr. Easterly's full bio will be included in the post, and stay in contact, and let's do the big things and the little things to help move this movement of meaningful change forward. Thank you.
Thank you.
Ryan, are you still with us?